Welcome back. Joining us today is Colleen Cudo, Supervisor of Language Services at Mayo Clinic Health System. Hi, Colleen.
Good morning.
Thanks for joining us.
Thank you.
Yeah, so today we are talking about the importance of interpreters in a hospital. So how important of a role is interpreter services to a hospital and for the patients?
Extremely. We are with patients that right as they walk into the door until the end of their appointment, whether they have to go to finances and stuff. But you have to remember, patients come in very vulnerable anyways. When you go into a doctor's, a lot of times you'll notice that your heart rate goes up because you're a little nervous. Can you imagine now taking the language, common language away from you and not knowing what actually communication is going to occur or what's going on if you don't have an interpreter?
Yeah, and how often are you used during the day?
Oh, all day long throughout the day. I mean,
Sure.
We cover a lot of patients. We have 4 different languages that we offer on-site interpreters for, and they are continuously busy 24/7.
And you mentioned you have 4 different languages you use. What kinds of language are those?
We have Spanish, Sign Language, Hmong, and Portuguese.
Okay. And can anyone be an interpreter, and how can someone become one?
Yeah, anyone can be an interpreter if the passion is to work with people. You have to have a really good command of the language. We do have here at Viterbo in La Crosse, we offer a certificate that somebody can go in, learn a little bit more about the process of interpreting. Sign language is more of a 4-year program that you have to get nationally certified, and it's dependent on where you're working. A medical situation, you definitely have to have a good command of the language, and you need to have certification in order to work there.
Sounds like it goes a long way.
It does. It's great.
Okay. Thank you so much for joining us, Colleen.